Today, we will be discussing about a very hot topic in dentistry nowadays, that is chemo mouth. In this webinar today, I am excited to share some important steps how we can effectively manage oral side effects of cancer treatment. My goal here is to make this presentation very informative and interactive, so I will definitely encourage everyone to participate in the discussion as we move along. Dr. Rowling has very well covered my bio in detail, so I will skip this information here to save some time for ourselves during discussion. So the educational course learning objective in today's seminar is number one is to identify the common oral side effects which are associated with cancer treatment such as mucositis, xerostomia, metallic taste, and irrespective of the cancer treatment, whether it's in chemotherapy and radiation. Second is to develop a patient care plan that we can include based on our the evidence-based science and how we can able to manage the symptoms related to chemo mouth in general. Our third goal here is to evaluate the role of natural oral care products where we can use the natural and clean ingredients based oral care products, and that can really help the cancer patients in managing their oral side effects very precisely. And fourth is to implement how we can implement the lessons which we are going to learn here in order to manage the side effects of chemo mouth and how best we can adapt in our dental clinical settings for having a maximum output of the clinical results. So let's start. Before moving ahead, disclaimer here, this continuing education webinar is sponsored by H2 Ocean, and I'm currently serving as Chief Scientific Officer for the company, and also I have financial relationship with the company currently. Now, the foremost question is, why are we discussing chemo mouth? What is chemo mouth? So the cancer patients have many thoughtful questions that they need to be addressed by us as dental professionals, because the patients have a lot of queries in their mind related to their oral health before the start of the cancer treatment, during that cancer treatment, as well as after their cancer treatment. They have a lot of questions. I mean, which oral care products should they use or avoid during cancer treatment? What is the best salt water rinse for their oral care during cancer management? How can they effectively manage oral mucositis? What are the best ways to prevent dry mouth? How do they manage a metallic taste in the mouth? How often they should visit the dental office, and after even completing the treatment, do they have to do something differently? And how they can lower their risk of oral infections during the cancer treatment or even after finishing their chemo or radiation cycle. So these are very provoking questions, and we as the dental professionals should be very well equipped with the latest information and knowledge so that we can address these queries in a very well informed decision basis. So the number one thing starts here is cancer survivorship is a long journey. People sometimes get confused, like they need special attention in terms of their oral health. Sometimes patients get confused. Sometimes even our colleagues get confused that we have to give a special attention only during the active phase of chemotherapy or radiation therapy. It is not that. The survivorship for a cancer patient begins the moment diagnosis is made, and it continues throughout a person's life. So it's a long-term effects that we have to deal with, and that we have to help those patients in managing their complications associated with the cancer treatment. So like when we give a cancer care, it's a teamwork. So cancer survivorship, maybe oral managing oral side effects or systemic side effects, it's a team, and we as the professionals play a very big role in it. And definitely our role and goal here is to give at most and top quality dental care to cancer survivors. Now, this is Indeed, very promising number. Currently in US, there are 18.1 million cancer survivors. By 2040, the number will increase to 26 million. And out of that, 18% of those people live 20 plus years. 47% of those population lived 10 plus years. 70% lived 5 plus years. And top of that, 78% of the survivors are 65 plus of age. So that means not only we have a higher number of people who are cancer survivors, but the rate of survival as well as their age really matters, because then the geriatric complications come into picture and we have to be more precisely careful in order to give the best oral care to those patients. So this is indeed a very promising number, but we may also consider whether we are adequately prepared to provide the necessary care to all those survivors. I'm trying to move to the next slide. Okay. Yeah. So irrespective of whether the patient is having a chemotherapy and radiation therapy, it affects both oral cavity and systemic health in general in terms of complications or side effect is concerned. So it really doesn't matter, right? So do you have the patient is going through radiation or chemotherapy? Above all, there are certain amount of complications, there are certain amount of side effects that the patient has to deal with, and we as a care provider must be acknowledged to address those conditions. So the cancer survivorship is absolutely very great, right? We want more survivors, we want them to come back to the normalcy of the life as much as possible. But cancer survivorship presents several challenges also that continue beyond treatment completion. Survivors may experience psychological challenges such as anxiety and depression related to the health, fear of recurrence, and the adjustment to life after cancer treatment. Out of that, oral health is also a major concern, particularly in managing the lasting oral side effects of cancer therapy. These effects can lead to various physical and emotional issues, including oral pain, dry mouth, taste changes, difficulty in eating food, all of which significantly affect survivors' quality of life. So it's overall impacting the quality of life of a patient. In oral cavity, irrespective of it's an hard tissue or the soft tissue, whether it's a tongue, it's a hard palate, it's 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 salivary gland, it's taste buds, it's roof of the tongue or tip of the tongue, irrespective of the tissue involved, every tissue has to deal with certain kind of side effects associated with the cancer treatment. And the commonly side effects which we observe in day-to-day clinical operations in side effects related to cancer treatment are: number one is mouth sores, or we can say that chemo mouth sores, mucositis, ulcers, xerostomia, or dry mouth. These are the key clinical pictures which we often seen as a side effects of the cancer treatment. After that, there are other complications such as microbiome imbalance, and we'll discuss in detail how the microbiome imbalance happens. Opportunistic infections happens, pain is a very persistent symptom, taste alteration, metallic taste, then followed by dysphagia like difficulty in eating food, inflammation, gum disease, periodontal disease, and so on. So we'll discuss some of the key side effects in this presentation and how we are able to give a solution to those side effects. Chemo mouth sores or oral mucositis. It is the 40% of the cancer patients usually suffer with this complication. And especially if the cancer is related to head and neck, then the percentage is almost 90%. So almost everyone dealing with head and neck cancer has to deal with oral mucositis. Clinically, they represent as very red swollen areas that has a painful ulcers, and it definitely affects patients' ability to eat, drink, and speak. Imagine a situation where a mother has gone for a treatment related to head and neck cancer or cancer in general. After coming back to home and the kids are waiting for their mom, the mom is not able to talk to their kids because of mouth ulcers or the mouth sores. So I just want to give you a scenario. It's not only the physical challenge, these side effects also have emotional challenges in the family. So we have to be very careful and we have to be very mindful in giving those solutions to these kind of side effects and the associated challenges associated with the cancer treatment. Mucositis is also responsible for secondary infections as well. These are the typical clinical pictures of oral mucositis lesions. So you can see that the ulcers are happening at the tongue, on the buccal mucosa, floor of the mouth, hard palate. So each and every part of the oral cavity is affected by mucositis. Now let's understand very briefly about how the pathophysiology of the oral mucositis occurs. So chemotherapy drugs primarily targets rapidly dividing cancer cells, but also affects normal cells, particularly in the oral mucosa. Mucositis begins with DNA damage in the basal epithelial cells, and the damaged cells release pro-inflammatory cytokines like interleukin 6, necrosis factor alpha, interleukin 1 beta, and all these pro-inflammatory cytokines triggering an inflammatory cascade. And the free radical oxidants generated by chemotherapy also contribute to degeneration of the mucosa and altogether worsening the ulcers and the situation. So it's an ongoing process during and even after the completion of cancer treatment. World Health Organization has categorized different grades of oral mucositic lesions based on the clinical picture. So in the grade 1, there is some soreness and erythema. You can see the clinical picture here. Grade 2 is bit of more challenging situation where you have, along with erythema and ulcers, patient can swallow food, solid food. Severe mucositis occur in grade 3 and grade 4 situation. Grade 3 is extensively erythema. Patient cannot swallow the food. So the patient is always on the liquid diet. And grade 4 is extremely life-threatening situation where the patient even cannot drink any liquid. So it's always going through the IV infusion. So these are the different clinical pictures, like how worsen a situation can be and what does our role as a dental professionals here in order to help these kind of situations to prevent them to getting more worse. Second most important feature is clinical picture that we can see in the oral side effect is xerostomia. So in general, normal unstimulated saliva flows from the range of 0.3 to 0.5 milliliter per minute. But when it drops below to 0.1 to 0.2 milliliter per minute, the patient begins to experience the symptoms of xerostomia. So here the situation is that chemotherapy and radiation therapy, especially radiation therapy, damage the salivary glands and inhibit their ability to produce saliva. And with reduced salivary secretion, it gives a dry atmosphere inside the oral mucosa, and the mucosal immunity does not play a big role in preventing the infections. And with worsening of the dryness in the oral cavity, it can make the patient difficult to eat, speak, and swallow. And this dryness, if it further gets worsened, it disturbs the oral microbiome, as well as it also gives an opportunity for the opportunistic infections such as oral candidiasis to also come into the picture. So it's a very big situation, and we have to deal with that in such a fashion that it can be managed on day-to-day basis rather than managing the dry mouth by supplements or other kind of drugs. It's a clinical picture of a xerostomach tongue, and you can see that grooves and fissures of the tongues are so much prominent, and it all happens because of the dryness. So it's a true clinical picture of how xerostomia can look like in a clinical setup. So when we understand the pathophysiology of xerostomia, chemotherapy damages salivary gland, particularly the acinar cells, leading to reduced or absent of the salivary flow. I mean, though there are certain conditions, around 1100 medications have been identified that can also contribute to xerostomia. On top of that, if the patient is dealing with the radiation therapy or chemotherapy, the situation becomes worsened. Additionally, if there are other autoimmune conditions such as autoimmune diseases or uncontrolled diabetes or hormonal changes in the women, so the condition become more worsened. So xerostomia is really a big deal, patient dealing with cancer treatment. As we discussed the clinical picture, it's one of the most common side effect. The patient often experience a dry, sticky feeling in the mouth all the day, and it's a subjective sensation. And sometimes it's very difficult for a patient to describe how worsened the situation is until unless we able to monitor the salivary flow and can categorize what kind of xerostomach level the patient is having. It's sometimes it's described as a clinical picture when the patient have ropey saliva and even there is a difficulty in speaking. So that's altogether it influences the quality of the life because you can't speak, you can't eat food. In overall, it will affect your swallowing, it will affect your digestions, it will affect your enzymes in the oral cavity, and altogether, it's a kind of a miserable situation if you are dealing with such kind of worsen xerostomach situation. Third, very important situation that can be seen related to the side effects of the cancer treatment is metallic taste. I mean, I have seen from my friends of friends and different relatives also, the patient reports a very metallic taste, somehow like alkaline in the mouth. I mean, they feel like they have some metal uh, acids on their mouth, and there's a reasons for that because taste cells regenerate very rapidly and making them very vulnerable to chemotherapy. And once they get affected due to chemotherapy or radiation therapy, and the patient loses their metallic, their taste buds. And that plays a very big role because if you have a strong metallic taste in your mouth, you are not able to eat food. Uh, it impacts very precisely over the eating, over the speaking, and it drops the patient nutrition significantly, and that can further trigger effects on the patient's health, and that health is directly related to how much the patient can take further the chemotherapy and radiation therapy. So it's all interlinked. How is your oral health? How the oral health is affecting your systemic health? And if its systemic health is get deteriorated, how you are able to take care of the rest of your active treatment or even managing the different side effects related to cancer treatment. So 50 to 60% of the patients, especially with the head and neck, usually suffer metallic taste in their mouth. And definitely, when you have a dry mouth, when you have ulcers, when you have metallic taste, it will multiple times increase the opportunity of the different fungi and other opportunistic infections to proliferate and grow in the oral cavity. It's a typical picture of how the different organisms play a big role into that. Another important factor here to note is that oral health is directly related to so many systemic conditions in our body. Like we have plethora of documentations, scientific evidences, direct correlation of how oral health is related to diabetes, pregnancy outcomes, Alzheimer disease, cardiac disease, and so many things, male impotency, and so many things. So it's not only the oral cavity. So one of the biggest challenge here is that sometimes the oncologists and the people who are dealing with the medicine sides of the cancer treatment ignore dental treatment as one of the significant part of the cancer care team. And that's why where we come into picture, like, we should be a part of the cancer core team, because oral health is directly now influencing the systemic health. So let's discuss how to deal the oral care in chemo mouth. What should we do in order to mitigate those situations, to prevent these situations, and even if sometimes this situation occurs, how we have to deal with them in a more natural way rather than synthetic or chemical based. As the golden saying says, prevention is always better than cure. There is no treatment that can outcome the prevention side of any disease. So, first of all, and the most important is identifying and managing the predental conditions even before the patient starts their active cancer treatment. It will definitely prevent a lot of oral complications that the patient has to deal with, whether it is radiation caries, dry mouth, metallic taste, and so many other things, because those complications further make it very difficult to handle any active dental treatment if the patient is not been given a proper oral care before the start of the cancer treatment. Also, it will lower the risk of opportunistic infections. It will enhance the nutritional uptake if the primary dental treatment is given before the treatment. And overall, it will improve the quality of life. And that's why, as I mentioned earlier, it is very important to consider dentists, dental professionals, dental hygienists as a very strong integral part of the cancer care team, even at the time of diagnosis, not even before the start of the treatment, before the start of the treatment, at the during and at the time of diagnosis, dental care professionals should be the part of the cancer care team to prevent multiple side effects and to prevent multiple complications that can be taken care at very early stage. The golden rule is, as always, maintaining a good oral hygiene, brushing twice daily with a soft bristle toothbrush. Definitely, we don't want to use any hard brush. We don't want to use any strong bristles that can ulcerate and that can lacerate the ulcers, that can cause bleeding. So we have to avoid those kind of things. We have to use gentle, soft oral care products. So when we say gentle and soft oral care products, means those oral care products that are not made with any alcohols, chemicals, synthetics, dyes, fluorides, uh, and the strong fragrances, because these irritants are going to irritate the oral mucosa and make the situation more worsen. So we have to be very mindful in selecting the oral care products when we recommend the oral care products to the cancer patients. Cancer patients means cancer survivors from their diagnosis throughout their life, irrespective of whether they are actively taking treatment or not. Third golden rule is that they should have a frequent dental checkup. I recommend always having 3 months. So after 3 months, they should visit to a dental office, get their thorough oral examination done, so that if there is any initiation of cavity or something, initiation of gum disease or gingivitis, it can be taken care of at a very early stage. Fourth important thing is that if all the things are taken care, as we mentioned, it will definitely enhance the quality of the life of a patient. And the quality of a life of a patient, when it has been increased through oral cavity, definitely it gives its reflection in better quality of life in systemic health in general. Another careful aspect is to avoid any spicy food. Definitely, as we know, spices and chilies will increase the irritation to the oral mucosa. So the goal here is to keep the oral mucosa as calm as possible, as gentle as possible, and we do not have to irritate the healing mucosa, because in order to have a proper healing, you want to supplement oral mucosa with the right nutrients, with the right minerals, with the right enzymes, rather than giving them some irritating chemicals or synthetics. Avoid sugar rich foods. Definitely, sugar is one of the leading cause for dental caries if it is taking a large amount and also in the frequent amount. So, frequency matters a lot. Staying hydrated, nothing is better than water. So keep the hydration level high by drinking and sipping water as much as possible will definitely help the cancer patients in maintaining that moist level. And eating soft food, nutritious food definitely is going to help the oral health as well as systemic health in general. Now comes the dental care part. Regular oral care products do not work for cancer patients. Avoid because they cause more harm than benefits. Why? Because all the chemical based ingredients can cause tissue irritation. They increase the risk of infections and may trigger allergic reactions because the patient immunity is already way down. They can worsen the dry mouth because of the alcohol they have. They can create an acidic pH environment because of alcohols and chemicals. And altogether, they will delay the healing process. Furthermore, these ingredients can disrupt the oral microbiome. That's very important and complicate the oral health during chemotherapy, radiation therapy, even after the treatment is over. So, patients undergoing cancer treatment need more nutritive, mineral enriched, natural oral care products that are gentle, non irritating, free from any harmful ingredients that can support oral health and ensure a 100% comfort to their oral health. Now, there is a lot of data. This is one of the study published in Nature that mentioned that the chlorhexidine affects the oral microbiome. So now we are discussing some science here, like why the regular oral care products do not work. Let me share another study. So another study published in journal of in a spring journal, a very well respected publication house, and they mentioned that the oral hygiene cause based on synthetic products disturb the oral microbiome. So as we know, there are millions of bacteria forms a complex oral microbiome inside the oral cavity, and that maintains a very natural balance. So when you have a balanced microbiome, it can protect against infections and inflammation. But when it is get disturbed through chemicals, alcohols, preservatives, it can lead the harmful bacteria to thrive and increase the risk of ulcerations, increase the risk of opportunistic infections because the good bacteria now are in less number and the bad bacteria are in higher number. So maintaining a well-balanced oral microbiome is very, very important in order to maintain a good lifestyle, especially with the people and the patients that are cancer survivors because their immunity is already way, way down. Also, there are scientific evidence. This is another interesting study that is published that mentioned that over-the-counter mouthwashes that contain sugar, syrups, alcohols, colors also increase the risk of prediabetes and diabetes. Another scientific evidence, it's another publication that shows that because of chemical-based, alcohol-based oral care products. It can disturb the oral microbiome, and it's totally detrimental for the oral health. So huge data that really supports that, these products are not the solutions for oral care. Another study that mentioned, it is a recently published study in JAMA, Journal of American Medical Association, that mentioned that fluoride in the oral care product causes neurotoxicity to fetus and the young babies. So that's also a very major part of concern. Like for those cancer patients, for those survivors, you don't need extra amount of fluoride. And I understand fluoride is nowadays a very much hot news, with different opinions around the different professional bodies. But we should have to understand fluoride is not bad. For the amount of fluoride, what you are getting, the dosage of fluoride and the source of fluoride is important to understand. If you are topping yourself or the oral care product with synthetic fluoride, that is bad. But fluoride is everywhere. Fluoride is in salt water, fluoride is in food, fluoride is in air. So that fluoride is not dangerous to you. It doesn't cause any harmful or side effect. But if you top yourself or the oral care products with the synthetic fluoride, there comes the issue. So, and we have scientific evidences that mention those issues here. This is a reference from CNN. Like fluoride in water prevents some cavities, but health risk raises questions about the trade-offs involved with the fluoride. So these are all very much new science, new evidences that nowadays coming up. Another important topic here to mention is red 40. I mean, this is a very common color, which is synthetic color, which is added to a lot of oral care products. When you see the shiny, bright red color mouthwashes or the toothpaste, nothing is real there. Everything is chemical, synthetic. Red 40 is a very dangerous chemical, so we should not avoid those kind of oral care products that contain these synthetic chemicals and colors, especially when you have a very compromised immune system, very compromised oral mucosal immunity, and when you're the first line of defense, your oral mucosa is already ulcerated, is already lacerated, is already prone to infection. You cannot you cannot ask your patient to rinse with those chemical based oral care products. They will not get any benefits, but definitely it will affect and worsen their situation. So that's very important to understand why these ingredients are so harmful. Another study published in Nature, that even the mouthwash that we use orally, it affects the gut microbiome. So because once, irrespective of how you do a mouthwash, a part and a section of the mouthwash slips, and when it enters your digestive tract, it affects your gut microbiome because it's a chemical, it's a color, it's alcohol, it's all synthetic. So we have those studies coming just now. Another study that mentioned that the oral microbial environment always get affected when you have synthetic based antimicrobial mouthwashes and oral care products. So there's a lot of evidence, and these evidences are coming right now at this stage of science because we have better equipments, we have new studies, we have new research, and we have new products that are coming into the market, and people are trying to maximize their business profits irrespective of the ingredients involved in these kind of oral care products. So we as a dental professional should be very mindful what kind of oral care products we are recommending to the patients. So now the question comes here, when everything is so complicated and we can see everywhere there is a sea of red and blue, so where is the solution then? Then what should we recommend? What is the solution? Then solution lies in the nature. When we say nature, it's a natural oral care products such as sea salt. Why sea salt? Sea salt exists even before the existence of human being because sea salt comes from the sea, the oceans, and these oceans exist even before the existence of human being. There's a huge data why and how the sea salt can be such a great oral care product for not only for cancer survivors but for anyone who wants a great oral health without involving any alcohols and chemicals. So the number one is that they are gentle and safe formulation. So because they are free from any artificial colors, dyes, chemicals, fluorides, sugars, preservatives, so they are always gentle. They are non-irritating to your oral mucosa. You don't have any burning sensation. Your tissues feel calm. Your tissues feel relaxed, and that's what we really need for the ulcerated tissues in the oral cavity to get themselves settled and heal perfectly. Second is the sea salt contains lot of minerals, and also it depends upon the type of sea salt which is involved in the oral care product. It really is a huge matrix of minerals which are essentially present in sea salt that can definitely help in maintaining the oral health and supplementing the oral tissue with lot of minerals and enzymes that can build up the immunity of the oral mucosa. Third important factor is it reduces the inflammation in general. Contrary to the alcohol-based and chemical-based oral care products that cause irritation and burning sensation and delays the healing process, the sea salt-based oral care products reduce inflammation and swelling because their hypotonic nature of the sea salt draws the excessive fluids from the inflamed tissues and reducing swelling and promoting a well-balanced environment in the oral cavity. Also, they are naturally pH balanced. I mean, it's a huge topic to understand pH. I mean, I can speak for an hour why pH matters, how pH matters, and it's a different altogether a different seminar. I can say that, but definitely the natural oral care products such as sea salt based oral care products maintain a well balanced pH while maintaining a good oral health. And the most important is the sea salt based oral care products are natural antimicrobial agents. Why? Because they have such a huge variety of minerals. For example, sodium chloride. I mean, sodium chloride helps dehydrate harmful bacteria and inhibiting their growth. Magnesium. Magnesium possesses anti inflammatory and antibacterial properties, promoting skin and mucosal healing. Calcium. Calcium supports the barrier functions of the cell and play a very important role in bacterial defense. Potassium. Potassium it aids in balancing the moisture in the tissue, which helps control bacterial growth. Zinc. Zinc is known for its antibacterial and wound healing properties, and further it reduces the infection. Aluminium. So there's so many things and so many micro elements present in the sea salt that really works synergistically in the right amount, in the right quantity, so that it can give altogether a very good, gentle, and solid result in the oral cavity. And our grandma to grandma, generations to generations are using these sea salt based rinses in order to keep the oral health in a good shape. Saltwater rinses are best for chemo mouth, especially for the chemo mouth. Anyone dealing with cancer care during, before, and after radiation therapy, chemotherapy, these are the best solution because it will relieve from the soreness, doesn't contain any chemical dyes, it alleviates most of the symptoms, and definitely it maintains an oral microbiome. It doesn't disturb the oral microbiome. There's a huge evidence why salt rinse is so much recommended by all the major oncology hospitals nationwide in the US and worldwide. National Cancer Institute recommends salt rinse for managing oral side effects. There's a lot of clinical research studies that can say that it is as effective as magic mouthwash in treating oral mucositis. American Cancer Society journals have a lot of uh, suggestions that recommends saltwater rinse for oral hygiene in order to maintain. And they mentioned that chlorhexidine should not be used in the prevention of oral mucositis in patients undergoing head and neck radiation therapy. So these are the journals that drive the whole scientific traffic. The Cleveland Clinic mentions and recommends salt rinse as one of the gentlest and the most effective way of cleaning and sanitizing mouth sores. So all the major hospitals, Moffitt Center also recommends salt rinse for the treatment of mucositis. Mayo Clinic, UK National Health Systems, MD Anderson Cancer Institute, on their website, they mentioned that a daily salt rinse will reduce a mouth sore pain. Oncology Nurse Journal. So everyone, I mean, the point here is that each and everyone, the major hospitals around the world, in nation, in US, recommend salt as a solid treatment in order, not a treatment, solid way to manage the oral side effects of the cancer treatment. Even if you go on the media side, there's a lot of happening there. Like there's a website called drugs.com, well-informed website, where the professionals, MD doctors, are writing about does salt water helps in ulcers. Again, more web references where we can see that salt rinse play a big role in maintaining oral health. Again, there is a huge evidence that salt rinse even promote the growth of fibroblast. So fibroblast is responsible for healing. So if you use saltwater rinse, there is a 100% chances that there is a better healing, there is a better outcome of the oral care. Another solid evidence is research-based scientific publication that states that how the animal studies even also prove that how salt rinse can be so beneficial and so important in maintaining the oral cavity, especially dealing with the chemo mouth. But it is very important here to note that all salts are not equal. We have to very precisely understand which salt is the best, what is the mineral content of the salt, how the salt is harvested, how the salt is processed, and what is the purity level of the sea salt. So if we understand these 5 things, we can choose the best sea salt based rinse for the cancer patient. It is very important to understand the sea salt from Red Sea near Egypt is the number one nature's best sea salt source because it contains 82 plus minerals. And as far as my knowledge is concerned, there's only one company in the whole world that holds patent for this oral rinse. And during my following my presentation, there's a complete presentation here as well, where you can learn about the only company that holds the patent, that holds the mineral rich sea salt based rinse, why they are the number one dentist recommended sea salt mouthwash in the entire world. So, because they choose the best sea salt, the salt which is never compromised with the quality, and that's the main thing here. It is often confused that we can do an home-based salt rinse and it will be better for us. No, we should completely understand this very loud and clear that regular salt rinse, our table salt, is not the sea salt. It is very weak and it is very slow, and there's a huge difference between red sea salt and the table salt or the home-based salt, because Red Sea salt contains 80 plus minerals, while the table salt in our home contains only 2 minerals or elements, sodium and chloride. The sea salt from Red Sea is evaporated and sun dried, while it is table salt is commercially produced in factories in huge quantity. And sea salt from Red Sea is always organically harvested, aligns with the human system because it contains the right amount of the portion of the elements, minerals, and enzymes, and all together make a perfect fit for the human body and health, as compared to the sodium chloride, which is highly processed, chemicalized, and passes through multiple chemicals and chain reactions in order to maintain that kind of smoothness, brightness, whiteness. So that's the huge difference. So no, so you should not use table salt rinse because you will not get 5%, 10% results of the outcome of the oral mucositis or the oral side effects of the cancer treatment. But when you use the right type of salt, sea salt based salt, and sea salt based, red sea salt based oral care products, then you will get the maximum benefits of the salt rinse. There's a lot of data and a lot of studies that mention that why sea salt based rinses and sea salt based products are good for oral health. It has a lot of therapeutic properties, it has a lot of wound healing properties, and it has a lot of anti-cancer effects also. Some of the studies are mentioning that, and there's a study that is showing up that even the cancer cells get shrunken after using salt in vitro study. So it affects dental caries and so on. It possesses anti-inflammatory effects. It is very helpful in periodontal disease. It prevents oral microbial colonization because it doesn't kill the good bacteria, so it maintains the oral microbiome. So it brings a lot of benefits. And these benefits we are just discovering over the last decades, and even we are currently not even discovered the full potential of sea salt based healthcare products. And there are only few handful companies in the entire world which are really focused on the high quality sea salt based healthcare products. And H2 Ocean is one of the company, and you can see the company's presentation after my this seminar, and you will able to learn, and you will be astonished to see how much kind of science and how much kind of relevance they have in their products. And there's a lot of studies by the sea salt based oral care products that can show how they can manage the xerostomia, how it can help improve the healing process and maintain the oral hygiene even in the diabetic oral surgical patients, and also how they can improve the oral hygiene in among orthodontic patients. So there's a routine, regular clinical studies already done that can prove the effectiveness of these sea salt-based oral care products. So the key takeaway message for all of us here in this seminar is identify the early signs of side effects associated with chemotherapy or radiation therapy and start giving the oral care as early as possible. And it's always best to get a thorough checkup done before the start of the cancer treatment. Then also it's very important to maintain a daily oral hygiene and effective oral care. And the most important thing is that we as a dentist, we as a dental profession, it's our all moral responsibility. More than a professional responsibility, I can say that it's more an a moral responsibility where we should guide the patient in the right direction, like why you should use natural oral care products in order to have the best outcome for their oral side effects rather than putting them into chemical, alcohol, and synthetic based oral care products. And definitely, dentists are a part of the whole cancer care team, and we should always, get ourselves involved with as much as possible in order to provide the best oral care to the cancer survivors and helps in managing and making the quality of life better for them. With this I end my presentation, and I appreciate if you have any comments, feedback, and questions. If I am not able to cover any of your questions in my follow-up discussion right now, then please feel free to connect me through LinkedIn, send me invite, and we can connect through there, or you can directly email me, and I will be more than happy to address any of your questions or concerns you have regarding uh, dealing with the oral side effects of the cancer treatment. Thank you very much.
Thank you, Dr. Saini. We do have a few questions for you.
Yep.
What about toothpaste? What do you recommend?
Well, if you can able to find sea salt based toothpaste, then that's the best scenario. But definitely avoid those kind of toothpaste that contain sodium lauryl sulfate. So sodium lauryl sulfate is absolutely contraindicated, especially for the patients dealing with the cancer treatment. So
Sure.
avoid those SLS, and then you will be fine. And down the road, we will have more natural oral care toothpaste as well.
Okay, another question. Why sea salt? If sodium chloride is the primary causal agent that brings therapeutic benefits, wouldn't regular table salt do the job?
Well, regular table salt has only two elements, sodium and chloride, while sea salt from Red Sea has 82 minerals and elements. And also, it is never chemically processed, it is always organically harvested, unrefined, and always be in the natural form. So, the right balance of the minerals and the elements and the enzymes you get from the Red Sea salt, you are not able to get even the 10% of that in table salt.
Question here. Let me go back up. What form of fluoride do you feel is acceptable when dry mouth has transitioned to active decay?
Well, if there is a particular situation, like if you have an active decay, and if it is beyond something really of concern, then you have to go with a topical fluoride application based on the clinical picture. It is very hard to recommend something without any clinical judgment here, but definitely it then has to be decided on case to case basis. But I was talking about in general, the right amount of fluoride you can always get through natural sources. You have not to top yourself with the synthetic fluorides every day if you don't have any specific complications to deal with.
Is Himalayan salt good or not?
Himalayan salt is not sea salt, so it should be very able to understand. It's a mountain. It's not a sea salt. It's not harvested from ocean. So it's very important to understand, and that's why it's. I recommend that there are huge variety of salts when you to go to any grocery stores, but you will not find even one salt derived from the Red Sea because it's very small batches. It is always hand harvested and it's full of minerals, and because of its high quality, it is very expensive, and you will not find in any grocery stores here. And that's why those companies who are using sea salt from Red Sea in their oral care line or in their healthcare products, definitely you will get an added advantage and benefits.
I do have the link to H2 Ocean at the top of the screen for those of you that won't be able to stay on for a few minutes. If you tap on that, it'll take you to find out more information, order samples, and so forth. And if you can stay on for a few minutes, we have Eddie Kolos, who's the CEO, and he'll be talking to you about their products. Tracy wants to know, does baking soda toothpaste neutralize the acidity in the saliva and reduce likelihood of sores during chemo?
Well, it can a certain extent, but we can totally cannot rely on baking soda as the only ingredient that can manage. But definitely, it can neutralize. Baking soda can be neutralized in certain way, especially when removing the tartar or buildup in the oral cavity. So on that aspect, it can work.
Is Celtic salt good?
Salting salt, I mean, there's a different variety of salts. I mean, the more than 100 kind of salts you can find on the market. So it's not like that salt is good or bad. It's how we distinguish the best salt, and then we want to compare it with the different salts. So best for the healthcare based products because it's mineral rich, unrefined, hand harvested is sea salt from Red Sea. And then after that, you can have any salt, but you will not get that kind of benefits.
What mineral salts do you find in sea salt? Or
Oh,
what
there are,
minerals, excuse me.
I mean, there are more than 82 plus minerals in sea salt from Red Sea, from zinc, calcium, magnesium, potassium, you name it, it will have it. And here it is important to understand. Sometimes people get confused. The sea salt contains aluminium. The sea salt contains certain elements. That's not good for my health. It's not the element you have to understand. It's the quantity of the element present in that sea salt. If it is in point one, then it's not going to harm you because that point one quantity of that particular mineral is needed in order to maintain that balance and in order to maintain that equilibrium of the salt to get that synergistic effect. So it is very important to understand when people try to understand the different minerals.
Dr. Saini, let's talk about xylitol a little bit. That's a class that I present. There was a comment about xylitol. They're not recommending it anymore. I want to point out that the body actually produces xylitol during the chronic metabolism. Or metabolization of it. Xylitol, when you're rinsing with it, you're going to be okay. Xylitol is a prebiotic. It's actually good for the gut biome. Some of your gut microbes want xylitol to survive and proliferate. Go ahead, Dr. Saini. Jump in on me at any time here.
Yes, ma'am. You are absolutely right. I mean, xylitol sometimes, and it's all about the source. I mean, like if you are driving the xylitol from the fruits and vegetables, it's a plant-based source, then you are good with that. And from what source are you getting in? And as you rightly mentioned, like our body also produces a certain amount of xylitol, and it also depends upon the what kind of source of xylitol you are using. If it's a plant-based, it's a natural source, then it's good for you. It doesn't have any side effects if you are using in a day-to-day basis. There's a lot of evidence that there's a lot of evidence, and you know much way better than me in xylitol. You conduct the whole seminars for xylitol.
I value your opinion, though. It's your course. Can you recommend a mouthwash with clean ingredients for dry mouth? If you stay on for a few minutes, there will be that recommendation. Anything you'd like to say, Dr. Saini, about that?
Yes, I mean, as far as I know, and as far as my understanding, and as far as my knowledge is concerned, there is only one sea salt based company in the entire world that holds the patent for the sea salt from the Red Sea, along with xylitol and lysozyme, and that is H2 Ocean Healing Rinse mouthwash. And that's the #1 mouthwash for the sea salt based product in the entire dental industry right now. And it is leaping very much forward and very strong in the oral care industry. And I think the future is great here.
What active agent is in the Red Sea salt that is missing in other salts?
Which is missing, or which it contains?
Well, the question is exactly what does it contain that you wouldn't find in just regular table salt?
So table salt is not sea salt. So let's do not compare table salt with sea salt. It's entirely a different thing. It's like comparing with apple and oranges. So it's table salt is not sea salt. So that's out of picture. Table salt is 2 elements, highly chemically processed. It is produced commercially, and it only has 2 elements, sodium and chloride. Sea salt, especially from the Red Sea, has 82 plus minerals and elements, and that all together are balanced in synergistically and naturally way in such a way that it gives the maximum benefits without any side effects. So that's very important to understand here. So we are trying to bring something very natural and as much as possible without adding any preservative chemicals, alcohols, dyes, fragrances into that. So that's very important to understand when you understand the salt.
All right, we're at the top of the hour. I did post the code, and you'll see a purple box in the chat area, 482753. Don't go anywhere because we're going to show you a quick video on where you can get the products that Dr. Saini describes, and then we'll have Eddie Colas join us for any questions that you might have. Please make sure, Dr. Saini, you're on mute. I'll be on mute, and we'll go ahead and play the video here. So the code 482753. It is also in the chat area. You'll see the link to the quiz, and stick around because you'll be able to find out how to get these products. I'll keep this up just a few more minutes. 482753. Please write it down. And we're going to show a quick video now. So please make sure that you write any questions in the chat area, and I'll go ahead and mute.
Hi, I'm Eddie Colas, the CEO and inventor of the first ever sea salt healthcare products. Today, I'm excited to introduce to you H2 Ocean, a global leader of sea salt healthcare products since 2001, pioneering the use of sea salt-based products in healthcare. Over the years, we have developed more than 32 products across various categories, distributed both in the US and internationally. Our commitment to excellence has earned us awards for Entrepreneur of the Year and globally recognized. We are not just about business, but we're also deeply committed to ocean conservation. At the heart of every H2 Ocean product is sea salt from the Red Sea, known as the world's most mineral-rich sea salt. This hand-harvested, unrefined sea salt contains over 82 trace minerals naturally aligned with the human saline system. This unique composition is what sets us apart from all the other products. We uphold the highest standard in quality in our production. Our products are patented, cruelty-free, and manufactured in an FDA-registered facility. We are committed to continuous innovation and development, ensuring that we stay at the forefront of sea salt healthcare. Now, let's focus on one of our flagship products here, the H2 Ocean Healing Rinse, the world's first sea salt-based mouthwash. What makes this so special? The key ingredients. Red Sea salt, enriched with 82 trace minerals, hand-harvested, unrefined, and perfectly matching the human body saline system. Lysozyme, an antibacterial enzyme that enhances immune system's protective function. Xylitol, a natural sweetener, approved by the FDA and widely accepted in the dental industry for its oral health benefits. Our sea salt mouthwash offers excellent results in various oral health issues, including dry mouth, bad breath, post-extraction care, implant hygiene, and daily oral care. It is safe for all ages, including diabetics, and contains no alcohols or dyes, or any harsh preservatives like fluoride or added sugars. It's scientifically backing. H2 Ocean's mouthwash isn't just a product, it's a scientifically proven solution. We conducted extensive studies on its effectiveness in treating gingivitis, dry mouth, dental caries, and for orthodontic hygiene. These studies have been published in reputable scientific journals. H2 Ocean has become the #1 post-dental care mouthwash for surgery, orthodontics, and implants. We offer excellent patient compliance with our cleaning with healing approach. Our product comes in 2 natural flavors, the Arctic Ocean Mint and the Lemon Ice, in 3 different sizes to suit your various needs: the 64 ounce, the 16 ounce, and the 8 ounce. For dental professionals partnering with H2 Ocean, we offer both clinical success and financial growth. We have 2 main partnership programs. A wholesale partnership. This program offers significant discounts, allowing partners to generate additional revenue. For example, our 8-ounce mouthwash bottles, we have a manufactured suggested retail price of $10, but they are available for our partners for just $5, offering a 50% profit margin. The affiliate program. This is a flexible, zero-commitment program that allows partners to earn without any overhead costs or inventory hassles. It's a simple 4-step process to get started, and partners can potentially earn a minimum additional income of $13,000 annually, based on referring 100 new patients each month. H2 Ocean is more than just a product. It's a revolution in oral care. Our sea salt-based mouthwash offers unparalleled benefits backed by scientific research and trusted by customers and industry partners alike. We invite you to explore partnership opportunities with H2 Ocean. Whether you're interested in the wholesale program or an affiliate program, we're here to support your success. Thank you for your time today. If you have any questions, please don't hesitate to contact us at info@h2ocean.com or call us at 772 219-8183. Together, we can transform oral health care with the powers of sea salt. Thank you and enjoy. Hello, everyone.
Hi, Eddie. We have a few questions for you. And everyone, this is Eddie Kolos. He's the CEO of H2 Ocean and the creator. He's got an interesting story about how he came into creating products like this. And most of us that are passionate about things, I think that leads us to innovation. So please ask your questions here. Eddie and Dr. Saini, here we have someone wants you to recommend a mouthwash with clean ingredients for dry mouth. I think we spoke about that before. I do want to let folks know the banner at the top of the screen will take them to complete some information to learn more. What minerals are included in your product is the question specifically here.
The minerals that are included in our product are very important minerals for the body. It's mostly the major, the minor, and the trace minerals that our bodies all need to use in synergy to actually transport a lot of the energy. And a lot of people think that just salt is electrolytes, but it's not just electrolytes. It's more than that. It is the mineral contents that you would find on the shelf of just the vitamins that you would want to take at a healthcare store. And when you're low on a lot of the deficiency of the mineral content, it could be either an iron, strontium, calcium. But calcium is not even going to get to your bones without the strontium and magnesium. So by understanding how some of these cells operate inside your body, and also as a marine biologist, understanding how the coral reefs and the fish and the interaction of the ocean and ecosystems need these minerals to produce certain things, is how I transferred this technology and looked for the best sea salt in the world. And that is the Red Sea, which is surrounded right now by deserts. And it's really the true organic sea salt that is found on this earth, and the most mineral enriched also. So the ocean currents actually take it to everywhere. So if you're looking at the table of elements, you're going to find about 82 of them that are very important, that are on there, that are going to be helping you in your health needs, basically.
Thank you. Someone has wrote, I've read that sea salt has a significant amount of microplastics in it due to pollution. Does the salt for this mouth rinse contain microplastics or get tested for them?
Zero. We are very careful with that. And that's why if you looked up even the Red Sea, it's not a sea that is mass polluted like some other sea salts or oceans in the world are. So we just take a look at the map. You see it's like the artery of this earth. It's one of the most important and protected seas on this earth right now today.
What is the shelf life of H2 Ocean? It seems like it would likely not have preservatives.
It is 3 years, and it will preserve even after opening it for quite a bit, either 2 years after opening, I would say. And that's because of all the right ingredients and elements that we've chosen to get it to be stable. It was quite difficult, but it is 3-year stability shelf life preserved.
Can this be used in place of sterile water in oral surgery?
Yes, it can. If a little bit is swallowed, it is fine. I actually brought a bottle of it here, which I will swallow it here in front of you guys. And I do that daily. It is simple. A lot of people also say rehydration comes from putting a little bit of salt in your water. We don't recommend table salt at all because that is a chemically processed with heated and also piped through massive machinery that could, salt eats up everything, all the metals and everything. So it might have little rust, metals, and high amounts of metals. That is not like that with our sea salt. It is raked into the beds and sun dried and then carefully hand harvested and sent to us.
Thank you. Is this a safe product for people with hypertension?
Yes, hypertension is caused because of sodium chloride, which is your major elements in the salt, it's too high, and then it will intoxify your body. We don't recommend making your own salt solution. And that's because people don't know the actual ratio on how to actually make it where it will naturally be used by our body. And that's why we recommend buying it already made. And plus, it has all the other elements that are used also for the benefit of your oral health.
Thank you. How long do the effects of sea salt rinse last?
The freshness that you're going to get is usually from the menthol that we put in there, in the natural mint or the lemon, because we have two flavors. It's going to depend on difference. If a healthy mouth is, more moist, then you're going to have a better effect. If you already have dry mouth, as you use more and more of it, you're going to get healthier and you're going to get rid of that dry mouth. So I can't really explain how long the effectiveness of the freshness that you're going to get. Everyone's going to vary.
If it's used as a rinse, how does it affect my bones?
How is it going to affect your bones? Well, I mean, you're going to have all those minerals that I said, calcium, strontium, magnesium, boron, all those are used in your bone. Calcium will not get into your bone unless you have those other elements that are going to deliver it to that bone.
Would this be good for patients with POTS who need salt? I happen to have POTS, by the way, but I have to drink liquid IV. Go ahead, Eddie. Sorry.
I believe so, because even before my time, I talked to one of the inventors of just the salt tablets that the athletes were actually using to hydrate themselves. Mm-hmm. So this actually, and that guy who invented that, Tony, is a friend of mine, had said that this is something so special that this would be more useful. And why didn't I just make it as a drink? So I just kept myself busy with more of the skincare elements. But I did have that also in my kind of inventor mind, to think that I could develop even a drink on this.
And also I want to add upon the Eddie's comment, like we have a lot of products and a lot of things in our pipeline that we can't reveal much of the information because of patent and intellectual rights. So we have a lot of things. So you can see 5 years from now or 3 years from now, H2 Oceans will be replacing all the big major oral care products in the world. So this will all be recorded in history.
And I'm sorry, go ahead, Eddie.
I mean, we wrote the book on the science of sea salt just to be published, where we were the very first thinkers on how sea salt will benefit in many ways in the human health. And we're going to be writing our next book, which is really dear to us, about like cancer, because that's what we're really focused on right now, is trying to help out people that are really in need and suffer, from just not just the pain, but the ability to, not that
once you have that cancer hit you, you're reading every label. And I can guarantee you that we've been clean from day one with all of our ingredients.
Is the flavoring an essential oil?
No, we don't use any essential oils.
Does H2 Ocean help reduce periodontal pathogens?
Yes, I mean, I want to take that. Like the early colonizers of periodontitis, like Prevotella intermedia or P. gingivalis or Fusobacterium nucleatum, the bridging organism between the early and the late colonizer. So definitely H2 Ocean maintaining the oral microbiome and maintaining a well-balanced pH and being a natural antibacterial properties. Definitely, it will help to mitigate the gingivitis and help in reducing the progression of periodontal disease.
Thank you. Would it be helpful for chronic herpetic lesions?
Yes.
Yes.
Okay. Would this be a great rinse for any cause of xerostomia? I have a lot of elderly patients that suffer with dry mouth from medications.
I mean, this mouthwash will be key for xerostomach patient, and definitely it's going to give the immense benefits irrespective of the level of the xerostomia is there, and most of that it doesn't produce any side effects or the bad effects, right? As compared to any alcohol-based mouthwash that again produces certain kind of xerostomia because of the alcohol and the chemical and the synthetics present in these oral care products. So that's why it is very important as we dental professionals should understand the right ingredients is the key moving forward. Now, organic is an old term, and the clean, natural ingredients and the companies focused on those things are going to survive and thrive. Otherwise, everything will be gone to history. Now, things
Not
are
only
changing in
that,
a very fast way.
not only that, we did do the clinical studies on that too as
Yep,
well, right?
yep,
And
yep,
it's
yep, yep.
peer-reviewed journals
Yes,
and published.
yep.
Would it be beneficial for post-perio patients like after scaling and root planing?
Yeah. I mean, that's one of the key benefit it has because you will mineralize the pockets and you will mineralize the gingival tissue with the right amount of the minerals and enzymes. Along with that, you are also not using the harsh chemicals and alcohol, so you will maintain the oral microbiome, and it's very good for the probiotical, the probiotics to work well and maintain the good bacteria in the oral cavity. So definitely, it will help in after the scaling and root cleaning, and definitely it will helps to heal better, and the patient will feel much better recovered and clean, squeaky clean mouth feeling after even using this mouthwash.
Are you taking applications from dental hygienists to rep your products?
Yes, we are, right, Eddie?
Yes, we are. Yes, just go ahead and fill out all the information, and we will be in contact with you.
So if you go to the top of the banner, it will go to their landing page. You can fill it out or scan the QR code if you can, and you can fill in the information.
And if you find any difficulty, you have the email address, and you can reach out to us, and we'll get back to you.
Can this be purchased for personal use, or is it for professional use only?
Oh, absolutely. It's personal use. We could also say that it's on Amazon for sale or on our website right now.
And on top of that, it's Amazon's best choice in sea salt-based mouthwash.
What is the recommended dose, and can you get too much?
Well, I have that story where a baby drank the whole thing because somebody left it out and it didn't have any effect on that baby at all. So it is safe. I don't recommend it as a drink, but I swallow a little bit of it every morning. It just feels good that it's cleaning all the way down the esophagus and everything. And I recommend that for people that have those cancer sores or mouth sores throughout their throat and everything to make sure they can get a little bit down at least.
How about dentist reps? How do they get a hold of you?
Same way.
Yeah.
Okay. Another question about post-extraction. Would it be beneficial for post-extraction healing?
Oh, yes,
Absolutely.
100%. 100%. Definitely. I mean, the patient will heal 100% much more better than anything else in the market right now.
Is it safe to use while pregnant?
Yes.
Yes. And also it's a diabetic safe as well. So it's a huge boost for any diabetic patients. So it's diabetic safe.
Going back up to the top here. Would you consider a plain or original flavor? I guess rather than any flavor.
I think we were just playing around with that. We did have just a regular plain with no flavor and salt, but we felt like that wasn't being, I think, accepted in the very beginning. A lot of people were saying, "Oh, salt," and salt is something that is your body thrives. So it might not be the very first taste that you want to taste when you have a mouthwash or something. But to add a little bit of flavor to it seemed to get more, I guess, benefit also of the freshness feeling in your breath. Like I said, even sea salt has zinc in it. And a lot of people say, oh, zinc. And one of our flavors also has an extra zinc gluconate in there, which is a little bit higher in zinc element for, taking care of your bad breath if you do have that.
Does it help to prevent dental caries?
Oh, yes.
And we've got someone asking for the phone number. We'll go ahead and put that in the chat. It's also on the screen. 772-219-8133.
8183.
8183.
Yeah.
Okay. Scrolling back down to the bottom here. Sorry, I did not hear the difference between the sea salt and other kind of salts. Can you make that clearer for me?
Well, it just depends on what area the salts are mined. And then I've also seen some questions on like Dead Sea salt. You have to, I guess, almost really do your homework and research either the labels or the origin where the salt is coming from. Dead Sea sounds like part of the ocean, but it's not. It's actually a lake. And if nothing lives in it, it's over mineralized. And if there's no circulation going on, the minerals actually can start clumping up. So sometimes you're going to get something that's going to be high in iron, which high of iron is not good for men. I've had, toxic in my blood of iron where I couldn't get rid of it. I had to actually give blood once a week to get rid of the iron out of my body. Wow. Because my body would not get rid of it. And that was the recommendation for the doctor, to go give blood once a week. Otherwise, I was very unhealthy. So when you're talking about sea salts and all different sea salts out there, I mean, there's misconceptions on that. My book is available, which is got over 70 professors from around the world in 30 different countries. And what was really miraculous is that most of them were writing about the Red Sea, right, Dr. Rajiv?
Yes, 100%. And there's a lot of the scientific buzz that how the sea salt is going to change the face of healthcare in down the road. And as we mentioned, we are not the oral care based company. We have hair care products, we have first hair care products, we have dietary products. So H2 Ocean is altogether sea salt based healthcare company. Even tattoo and skin care, that's also our one of the greatest best selling products in the entire world. So there's a lot of things, and this innovation is not going to stop anytime another 10, 15 years. So you see many more products coming up, and we are lined up with a new sea salt based natural toothpaste, and hopefully we are able to provide that as well in next couple of months as well.
How often do you use the rinse?
I mean, to be very honest, you can use twice, thrice, 4 times. There is no side effects. There is no harmful effects. But ideally, if you use 2 to 3 times a day, it will gives you a good benefits.
Do the
I mean,
salivary? Go ahead.
I had somebody that had really 22 mouth ulcers in their mouth, and he used it 5 times a day. And that got rid of almost all his mouth sores within 3 to 4 days, he said. And he never had that happen ever in his life.
Do
And
the
also,
salivary? Go ahead. Sorry.
Yeah, sorry. And also, I just want to mention that it's not only about the chemo mouth sores or the cancer patient, it's for anyone. So this is a daily mouth rinse that can be used by anyone, whether he's a healthy or a sick or cancer patient. So just to make it clear, like it's diabetic safe, pregnancy safe, and it can be used as a part of your daily oral hygiene care.
Do the salivary glands recover after successful treatment?
Well, it depends upon if there is no surgery involved, and I mean, as far as our profession is concerned, it depends upon the clinical picture. But it because cells regenerate, and it really depends upon the severity level of the destruction that happened to salivary glands. So, and also it depends upon how well you are maintaining your oral mucosal by giving the right minerals, or you are irritating oral mucosa every day, daily, by giving it alcohol and chemicals. So it's altogether a way of understanding why we need natural oral care products.
Just a comment and a question. I practice oral medicine. Many patients have a mint allergy. Can you do something like cucumber and or plain for them?
And we have the lemon that does not have mint in it at all. So cucumber, I don't think I'm going to make a cucumber one. But there will be other flavors, yes.
Do you have a sinus spray?
We do. And we have one that is maximum and a gentle that can be used daily. That's a pretty popular product right now. We are sold out, and we're waiting for our next shipment to come in. So it's a very popular product, even through singers and during the cold and flu season.
Do your products have the ADA product seal?
I don't believe so, but we do have the past ADA past president who had given us a testimonial that's sitting on our website right now, and we have attended their
so we were there a year before, and there's a World Fair of Dentistry held in New York, and Dr. Chad was the past president of American Dental Association, and he gives them strong testimonials promoting and encouraging our products to be used as a part of the regular oral care. And people can go to our website and see those comments and the remarks from those people.
Great. All right. Some more questions that came up. I'm scrolling all the way to the bottom. What kind of concentration of the salt in the mouthwash? Does the mouthwash have any other ingredients? And is it FDA approved?
It is FDA registered. FDA approvals are only for drugs.
And yes, the product also contains lysozyme, and lysozyme is a natural antibacterial enzyme. And another note to add is that H2 Ocean line of oral care product is the only product in the world that uses lysozyme as a part of natural antibacterial property, and that's a kind of present in every human fluid. So definitely we have sea salt, we have lysozyme, we have xylitol. This all three main ingredients that combine together give us synergistic effect.
Thank you. Any other questions?
No, but I'd like to say one little thing. As supportive of and having everyone knows there's somebody out there that have gone through either your family or cancer, And my younger brother did go through cancer, and I had to take care of him. Of course, he lived with me because usually they don't have a chance if they have to go through the chemo or a high radiation and the energy to go to work. So I actually took my time and took care of him. Well, for every 2 bottles that we do sell, we actually give 1 bottle, and that's our commitment to a cancer patient to try and to use during their recovery.
That's great. I had a father with lung cancer who had horrible oral mucositis, and he could have used this as well. Is fluoride one of the 82 minerals in Red Sea salt?
Yes, it is naturally found.
Does the product go into the periodontal? I'm thinking it means pocket here. This is a question from Janet. Can it be syringed into the pocket, Dr. Rajiv?
Yes, 100%. And being myself parodontist, I say that it's one of the very good oral irrigant, can be used not even for the periodontal pockets, but even doing the root canal treatments and for the endodontic, the decavitating and diswinging. Yeah, it can be a very great product. And we are in discussion with a lot of companies right now who want to collaborate with us because that's what the future is. And definitely you will see a lot of products from our side coming to the market nearby.
Any other questions for Dr. Saini or Eddie here? We really appreciate everybody that stayed on and everyone that attended this evening. This was an extremely large class, lots of great questions, lots of interest. You do have some handouts in the course folder that pertain to the products. You can reach out to H2 Ocean. You can reach out to Eddie or Dr. Saini to get more questions answered. Anything that you'd like to say in closing, either one of you, before we go and say good night?
I want to add before Eddie say the concluding remarks, like try something natural in your dental practice and you will see a huge difference in terms of, the post-operative care or the regular cleaning you do in your clinic. So give a solid try and we can almost guarantee 100% like you will not be disappointed with any of our product and you will definitely become a kind of a hardcore follower of our products. Thank you and have a good night.
And with over 20 years in business already, I have many, many stories to share. So I decided to start a little podcast too as well. But we're also open on one-on-one conversations to any dental practice that wants to get more information and some of those stories to benefit their patients.
Question here. Have you introduced this to the cancer institutions? Hi, Debbie. It's good to see you. When I went through radiation treatment, I was told completely different home care. This would have been a lifesaver for me. Comment here, one of the best courses I've taken in some time. Thank you. And last question, what type of fluoride is in your formula?
It's the natural based, all from sea salt.
Awesome. All right, everyone, I'm going to tell you all good night. I'll put the code up on the board one more time. Please write it down. Thank you, Dr. Saini. Thank you, Dr. Eddie, or you're the honorary doctor for this evening. Thanks for being here and supporting the program. It was an excellent opportunity for all of us. Have a great evening, everyone. Thank you.